Hi, Patrick here, the finger and hand rehab guy. You know, as a magician, a lot of people say it's all done with mirrors. That's not necessarily true, but when it comes to finger and hand rehab, a lot can be done with mirrors. So for this tip, I want to show you some of the great things that can be done with one of these. This is a mirror box. Now you can go and buy a professional one for probably 50, 60 bucks, or you can make one for about $5. So I'm first going to show you how to make one, and then I'll show you some of the neat things you can do with it. Okay, in order to make one, you're going to need a mirror. Now this is a 12-inch by 12-inch mirror that I picked up at the craft store, Michael's Crafts. It was about $5, and you could probably find them at, home stores like a Home Depot as well. And you can use any old cardboard box like this one here. I happen to have this lying around. It was the perfect size. In fact, if you look right there, it says 12.5 by 12.5. It'll fit a 12 by 12 mirror perfectly there. If you had to buy one, it might cost you $1. Now I decided to go super duper fancy on my particular mirror box, and I got this collapsible box from Target where the bottom comes out and then the whole darn thing folds flat so that I can keep it out of the way of the kids. And here is how it works. You're going to place the opening of the box toward you, the mirror on the outside. Now what you're going to want to do is put the injured hand on the inside, and you're going to put your non-injured hand on the outside. That's going to be reflected in the mirror. If you happen to be wearing jewelry on either hand, you should take it off. Really, honey. That's the only reason I'm taking my wedding ring off, is for purposes of this video. And then you're going to want to get two of whatever it is you're going to be working with. These are just little foam tennis balls that cost about $1 a piece. I really like them because they're kind of soft and squishy, and you can really work well with them. And you're going to mimic the movements both inside and out. Now your injured hand might have a hard time doing some of these moves, but that's the beauty of the mirror box. Because the healthier hand on the outside can do them, what you want to do is focus your eyes on the image in the mirror. And if you look at it, you feel like you're looking at both of your hands, and it sends a message to the brain that both hands are working and doing similar movements. In fact, I know some magicians who will use a technique like this to teach the opposite hand how to do some sleight of hand movements that the once dominant hand used to be able to do or can do. They teach both hands how to do it just by fooling the brain into thinking the other hand is doing the work that the powerful hand is doing. It's a really effective illusion, and it's fantastic in helping the brain form new connections to the injured hand and help it heal. When doing work with a mirror box, be sure to vary the movements as much as possible. The more variety, the faster this technique can help you. So, pick things up, squeeze like the soft tennis foam balls that I was talking about. You can even do rubber band work with extension, flexion, and extension type exercises. That will always help. The more variety, the better. The great thing is mirror box therapy will fool the brain into thinking that both hands are doing the same amount of work. And soon enough, both hands will be closer to doing the same amount of work. And part of the way it does this is by rewiring motor connections. So there are connections between your brain and hands, the communication centers. The beautiful thing is mirror box therapy, by staring at the healthy hand's reflection in the mirror, your brain thinks it's the other hand, and it starts rewiring connections to make sure that it can do the work that it thinks that it's doing. And that will facilitate that injured hand's ability to recover. Also, the beautiful thing, this actually relieves pain. There's a thing called sensory motor congruence, and it is reestablished when you do mirror box therapy and mirror box work, and the brain will stop sending warning messages to the higher centers of the brain. These are the pain centers. And when the brain thinks the hands are okay, it will stop sending a warning sign, i.e. pain, because there's no pain happening. I hope you enjoyed that tip. I look forward to talking to you soon.